Hello, everybody, and welcome to Functional Medicine with me, Dr. Howard Robbins. As you know, our show is dedicated to finding and giving you natural, safe, healthy, and effective ways. Safe, healthy, and effective ways of dealing with just about every medical problem you can imagine. Um, we're going to be doing an update today called Intravenous Ozone Therapy, Everything You Need to Know. I had a show posted from some time ago, but I want to give you all the latest information on it and update you on everything. So let's begin. So, first of all, ozone is a gas, it's not a liquid. And in our offices, and when doctors from around the world fill a syringe with ozone, and ozone has been around a little bit of time. The first paper published, well, actually, the first book published on medical ozone therapy was published by Charles Kenworthy, an MD, president of the Florida State Medical Association. And Dr. Kenworthy published a book called Ozone in Medicine in 1885. That's right, 1885. So it was used obviously medically prior to that for him to actually write a little book on it. And it was used commonly in this country up until the 1930s. That's when the FDA came into being. We had penicillin to kill infections, and you're going to learn about ozone's ability to deal with that. In addition, so basically, ozone was kind of phased out of this country because it's not a patentable medicine. It's made at the moment in time you need it in a medical ozone generator, the first one created by Nicholas Tesla back in 1895 or 6. It's made at that moment you need from oxygen, medical grade oxygen. So it's not a patentable medicine. If it were patentable, it would be in every hospital. You would have grown up knowing all about ozone therapy. So ozone therapy dropped out of this country and became noticed again, if you want to call it that, in medicine right after World War II in Europe. Basically speaking, we had the Marshall Plan to rebuild Europe, which we blew up and destroyed fighting World War II and the Nazis. And we had no money to give, or did we give anything of consequence in terms of medicine? So the Eastern countries, the communist countries, so to speak, at that time, got very involved in ozone therapy again, which had been used extensively before, during, and after World War I throughout Europe. So why? Well, they needed to be able to treat burns, wounds, infections, and everything, and illness, and they didn't have any money for medicine, and this was easy and cheap to make. So that's kind of a quick history of it, but let's get into what it is. So as I said, it's a gas, it's not a liquid. And when we fill a syringe and we push the gas directly into the veins, you'll learn about the different methods in a couple of minutes. It destroys every virus, fungus, yeast, mold, bacteria, parasite, toxin, and harmful free radical that's in the body. And in one method, the direct IV method, it actually can remove toxic metals from your body and take them off nerve tissue where all the damage is done by toxic metals. That's called chelation therapy. And no other form of chelation therapy, which is done around the world, can actually remove it off the nerve tissue where all the damage is done. So it's a very important and powerful treatment for that as well. So if you understand that it can kill all these harmful things, why doesn't it kill people? Why doesn't it hurt people? Well, when done correctly by medically trained healthcare professionals, medically trained healthcare professionals. This isn't something you want to learn off the internet and just start using because somebody posted it and allowed you to see simple methods of it, which seems simple and safe. And yes, if you can get oxygen illegally, medical grade oxygen illegally without a prescription. You can get needles and syringes illegally without prescriptions, or even legally for that matter. You still shouldn't be self-treating yourself. You should be in the hands of a medically trained healthcare professional who knows what they're doing with this. Okay? When done correctly, it's as safe as drinking purified water. Otherwise, you're running great risks, and you don't want to hurt yourself or somebody else just because it seems so simple. Okay? We have been doing this now. This is my 35th year. We're deep into it at the date of this show's posting. And we've done close to 400 and getting close to 475,000 total intravenous ozone therapies. That's more than any one clinic in the world, and possibly more than everybody in all of North America who does any method of IV ozone put together. No one has our clinical experience, actually. So with that depth of experience, we've only had 2 patients ever had to stop treating because they had what I would call an allergic reaction to ozone. And in the ozone world, it's not even, it's not discussed because it's virtually not been seen. I guess it's because I've done so much and so often we've pushed the envelope, though safely, for we take Dr. Do No Harm very, very seriously. In New York State, they don't care probably don't care if I kill you with a pharmaceutical. If I hurt one person with ozone, I'm out of business. And then worse than that, I've got to go to sleep at night. And I'm not the kind of doctor that can hurt somebody and go to sleep at night. I know many doctors can deal with that better, but not me. So we're here to get people well, not to harm them. So in any case, the amazing benefits of it's just astounding. And it comes with virtually no adverse effects. 2 people out of thousands upon thousands that we've treated, hundreds of thousands of treatments, and which, of course, we just gave them some Benadryl and it got them over that, and that was it. It was easy enough to treat. But there are side effects. Hair and nails grow longer, healthier, and faster. I'm the only one in my family at this age, with a full head of hair. It's still somewhat dark, though there's a lot of silver in it. My wife likes that. It's one of the anti-aging benefits. We've done several shows on that, of ozone therapy. So skin takes on a healthier look because it gets rid of all sorts of skin problems. People fall asleep easier, sleep better, need less sleep, more energy all day long. Um, uh, it acts as a painkiller, actually, and an anti-inflammatory, which is very important. It also gives more endurance because it helps the mitochondria uptake oxygen. The mitochondria are the organelles in your cells that make the ATPs, your energy. And if you listen to the show on anti-aging, you'll see how important that is. But it can give you more stamina and endurance, even for a workout in a gym or if you're a professional athlete. It stimulates natural stem cells and exosomes to be made in large amounts. That's why I speak at the American Academy of Stem Cell Physician meetings. It's tremendously powerful in that respect. So it does what I call repair the unrepairable and fix the unfixable in the body. Absolutely astounding and amazing benefits with virtually no adverse effects, and it has circulation benefits to boot. Okay, it has circulation benefits to boot. For example, it makes the red blood cells rounder so they flow smoother, easier, less viscous, which makes it very important for sickle cell anemia, thalassemia major and minor. It makes them more flexible to slip through narrowed, clogged, and hardened arteries better. And it also can chelate melt down calcified plaques, opening up the circulation as well as opening up the microcirculation. So it's phenomenal for many conditions and diseases like diabetes, arteriosclerosis, atherosclerosis. I mean, you can go through the medical alphabet on all the things that it can treat effectively and safely. And as you could see from many of the shows that I've done in depth, all the different, just some of the different medical conditions it's been known to treat safely and effectively. Now, there's various methods. We don't employ, I've tried them all. We've used them all, and we only use the most powerful ones. Many of the methods that are out there right now I call wussy methods. And I like to think of the methods that we employ as being what I call Arnold Schwarzenegger methods in medicine, meaning much more powerful ways of eliminating things. Much of the methods that are used can help improve just about every medical problem there is. On the other side of the coin, my patients don't come to me to get better. They come to me to get rid of their medical problems permanently, completely, once and for all. And that's the reason why we use the methods that we use. The number one method that we use is the direct IV method. This is where we push oxygen and ozone gas directly into your veins. Now, I started out using a method, and we've done that over 370,000 times, proving its benefits and its safety. Obviously, even though you may have a concern that it's going to cause some sort of an embolus of some kind, it's gas, medical gas, oxygen and ozone gas. It's not air, which it has a possibility of embolizing, and you would need gigantic amounts of it. Anytime an IV is given in a hospital or in a doctor's office, air gets into your body. In neurosurgery, 45% of the cases have what they call vascular air embolisms, VAEs. There is no such thing as a VAE, a vascular air embolism, in direct intravenous ozone therapy. There has never been a published death anywhere in the world, okay, in any medical journal when done by medical health trained professionals. I'm not going to say that people might have hurt some people, and you may find something somewhere in a newspaper about it. But when a doctor has been performing this, who's been trained, particularly by me, okay, the answer is, and it is the most common method used because it's the least expensive, easiest, and fastest method. It takes only 2 to 6 minutes to give as much as 60 cc's in a syringe, 8 to 10 minutes to give almost 120 cc's of medical grade gas at concentrations that have been proven to be safe but effective. You don't want to hurt anybody needlessly. And we have ways, I mean, all IV therapies can irritate veins, and we have ways of protecting it. Now, when I first began, I did a method called MAH, major autohemotherapy. There we would take out 300 cc's of your blood, just like giving it to the blood bank. You know, donating blood. Today they use 150s and 200s. Why the lower dosages, I don't know. And then we would push into the collection container, and we only use glass because it's the safest. These plastic bags that they're still using, I'm against. But glass is unreactive. And we would push in the oxygen and ozone gas, and that would mix in with the blood, you know, swivel it in with the blood, swish it in with the blood, and then let it drip back in like a blood transfusion. That process took as much as an hour. Today, anywhere from a half an hour to an hour is typical. It helped everything. We did it 45,000 times from 1990 to 95. It was my buddy, Dr. Robert Atkins, that got me started, the diet doctor. Told me, Robbins, you got to start doing ozone. So we began doing that. I met up with him to talk about it in November of 89. By January of 90, we began. And we saw it helps everything. By the end of 1990, by the middle of 1994, and certainly by the end of 1994, we weaned away from that method completely because it didn't help get rid of anything. It just improved conditions. And we went into the direct IV method, which we proved by then was not only safe, but amazingly effective in helping to get rid of things and cure diseases and conditions that we previously thought were uncurable and barely treatable. Later on, we added in a method called hyperbaric high-dose ozone with multipass. That was a method that my buddy, Dr. Rowan, kept telling me, I'm doing a method that's MAH, it's superior to you. I said, I do MAH, it's not superior. And we argued and we fought over it. And then when I went out to California, he gets me going on it, and I couldn't believe what I was experiencing. Blood was coming out of my arm into a glass collection bottle where there was a vacuum in the bottle. Just like when you do a blood test, the blood shoots into those little vacuum containers, containers, I guess they call them, little vials. There's a vacuum in there. The blood shoots in quickly. You may have noticed that if you've had a blood test. Well, there's a vacuum up in that bottle. So the blood comes out, about 200 cc's of blood, and it takes only about 2 minutes. It's unbelievably fast. Normally that would have taken a half hour. Then through a special German machine, a Zatzmann machine, a Zatzmann Hesse machine, as we use them now. You push the gas through that machine in through a little glass tube in the glass collection bottle. That pushes the oxygen and ozone gas into the bottle, creating a hyperbaric chamber in the bottle. So you're not sitting in a chamber. Inside the glass collection bottle with your blood is the chamber. Now that forces the oxygen and ozone gas into the blood and the blood back into your arm. Now, normally that, I told you before with MAH, that would have taken as much as an hour. 5 minutes. It's unbelievable. And we see bubbles of the gas going in as well. So we know oxygen and ozone gas is getting into your blood. Well, without stop, Johann Lahadny, that used to be called a treatment. Okay. And then about maybe 15 years ago now, a close friend of ours, Dr. Johann Lahadny from Austria, came up with the bright idea, why stop? Let's reverse the process again. And through that Zatzmann Hesse machine, that's the name of the company, you create a vacuum in the bottle again, blood starts coming back out of your arm to fill the bottle up. Then we reverse it. And we do it 10 times. Each time the blood would pass in and out, it would get ozonated. That's about 2,000 or more cc's of blood, mLs of blood, which is about half the blood in an adult human body. So humongous amount of medicine is going in. Ozone is medicine. It's just medicine. We'd go back into the body, okay, using that method that now has become hyperbaric high-dose ozone with multipass, which now is nicknamed on the internet 10-pass, okay, because of the 10 passes. There's other methods that people have been trying to employ to try to mimic this. Blood out and then back in, and then do it several times. Takes way longer without using these special machines. It's beneficial to do more, but it's still wussy therapy compared to the two methods, the direct IV and the hyperbaric high-dose ozone / 10-pass. Then we can add into the 10-pass method ultraviolet blood irradiation, UBI, and we use a state-of-the-art device called Hemolumin. Hemolumin not only uses UVA and UVC ultraviolet light, but we use it in both directions, the blood going into the bottle and the blood coming back out of the bottle. In addition, we add color spectrums. Light is energy, and colors, different color spectrums have healing energies. Blue, green, yellow, red, and amber. Light spectrums are put in both directions. An extremely powerful treatment added on to the 10 pass. By itself, valuable, but in combination with 10 pass, good. By itself, I have to put it, unfortunately, this is my opinion, everybody's entitled to it, along with MAH benefits. Then there's another method we stopped using. I ought to mention, just at least mention it a little bit. And that's where they take a bag filled with saline and you push the oxygen and ozone gas into the bag and you let that drip in. I don't know, people talk about it because it's so easy to do and perform, but it's, again, may help many different conditions improve, gets rid of nothing. We stopped using it back in the early 90s along with the MAH, okay, because my patients come to me to get rid of their problems. That's why you're here. You don't want to have to live with it forever. You just, at the very least, you want to improve it dramatically. And again, I should always say, no moral and ethical doctor should ever promise or guarantee a result. Even if you were successful 10,000 patients in a row, you never know what's going to happen on 10,001 for some reason. So, so it's important to give it your best to get rid of things, but you can't guarantee, nor should you promise, that you will absolutely cure or eliminate problems in anybody, even though we've had some amazing, wonderful, enormous successes with diseases and conditions that just absolutely blow you away. No matter what methods you use, and you can combine all these methods, there is no average, typical, or usual. One other method we're going to begin using, and we've done a couple of shows on it, is intravenous ozonated glycerin, which seems tremendously beneficial based on research on animals for cancer and for viruses as well. I mean, we've proven, and I'm published on Ebola, on SARS-CoV, COVID-19. We're published in many different areas. Bacteria, I'm getting published very shortly as one of the authors on Lyme disease. Look at some of our shows and you'll see just the depth and breadth and scope of intravenous ozone. But there is no average, typical, or usual number of treatments that it takes to get rid of anything in anyone. In my opinion, any doctor that gives you a number of treatments it's going to take is absolutely a bald-faced liar, because they do not know. And I'll tell it to their face if they ask me, okay, if they want to confront me on that. I know better than that. There is no average, typical, or usual. And patients always say to me when we get to that point in a consultation, I know you said there's no average, typical, or usual, but in my case, what is the average, typical, and usual? And I have to answer, there isn't. There is no way to know how many treatments it will take to fix anything in anyone. Why? Ozone is not a guided missile. I can't whisper in its ear, go after this virus, leave that bacteria alone. It has to destroy everything that doesn't belong in your body. And why it doesn't hurt you is because, and why we don't kill people, is because the human body produces in all our healthy cells antioxidant enzymes, superoxide dismutase, glutathione peroxidase, glutathione reductase, and another one called catalase. And these antioxidant enzymes are produced in larger amounts when ozone enters your body, probably through some signal, some enzymatic signaling that takes place. So healthy cells are reinforced and able to defend themselves against it, and unhealthy cells, all the different things, virus, fungus, yeast, mold, bacteria, parasites, toxins, cancer, harmful free radicals, cannot stop it from being destroyed by it because they just can't produce the antioxidants. Ozone basically steals an electron from them because it's an electron deficient molecule, and blows it up in a sense. It literally just destroys or inactivates the harmful organisms and whatnot. As far as harmful free radicals, it forms oxides like carbon monoxide, CO. CO is a harmful free radical. You breathe it in every time you inhale exhaust fumes from a car. You know it can kill you. Well, when CO plus O3, ozone, remember, CO, it's 3 oxygen molecules. What happens on the other side of the equation is you get CO2, carbon dioxide, and oxygen. Oxygen stays in your blood, so to speak, as a wonderful waste product, and then you breathe out the CO2. So it's absolutely wonderful and astounding in all the things that it can do. I think I'm going to do a part 2 now on everything you need to know, discussing all the different diseases and conditions that we've seen and that we've been able to help and improve, just not in depth, but what we have seen and what we've been able to do. So in any case, if you have any questions about this, don't hesitate to call my office. It's 212-581-0101. That's 212-581-0101. But you know what? I want to just give a little bit more into this show before we're done. I know it's a little longer than we like to stay with. If you're taking a pharmaceutical while you're doing ozone therapy, or if you're taking nutraceuticals, vitamins, minerals, herbs, homeopathy, Ayurvedic medicine, Chinese medicine, do it. I don't care what you've read on the internet. It's wrong. You can listen. No one has my clinical experience. You can do any pharmaceutical or nutraceutical with intravenous ozone therapy. I don't care what form you're being given. Okay? Now, unless you're getting blood thinners, which are needed in the there's always exceptions to that rule. If you're on blood thinners, then that has to be adjusted for the blood methods of ozone. When you're getting the direct IV method, you don't have to be concerned with that at all. You can stay on your blood thinners, all right? Because the blood methods of ozone require heparin or sodium citrate, which thins the blood, along with natural blood thinners, lumbrokinase or nattokinase, to thin the blood. Those are added issues that come with the blood methods of ozone therapy. Doesn't matter what blood method you use. But you can do all that. You can be on any diet you want to be on. You can do any other therapy like chiropractic or acupuncture or whatever. You can add all these things on with intravenous ozone therapies. And my clinic requires that you do 3 things. You have to be well hydrated. This is key. Human body is 70+% water. You have to take vitamin C, and then you're going to hear, well, you can't take it with ozone. Yes, if you were in a test tube, it would make a difference, but not when you mix it orally, when you're taking it orally 5 or 6 times a day. Ozone meets little to no vitamin C in your blood to neutralize one another. So the doctors or people that are telling you on the internet are wrong, and I can argue this out with them because I have the clinical experience to back up what I'm telling you. And then, of course, and you'll get more details on these things when we do the consultations. This is not a consultation, everybody. Let me make that clear. Even though you're going to have to hear a lot of this in a consultation, this is just part of one. It doesn't count as one in the medical office. Okay, if you go to another doctor, don't say, well, I heard Dr. Robbins talk about it, I'm ready to go. He or she still has to do a consult with you. And then, of course, we have to replenish good biome, and that's why we use Doctor's Biome, to replenish the good biome in your gut. Now, if you have any questions, I'm going to end the show now. You can call my office in Manhattan. They'll put you on to me. And that office number is 212-581-0101. That's 212-581-0101. Or email me at ozonedoctor, OZONEDOCTOR @yahoo.com. ozonedoctor @yahoo.com. Everybody, thank you for listening. Stay safe, stay healthy, and stay well. And tell everybody about my show so they can benefit from it as well. Bye now.